Hi, I'm Robert Jackman. Today I want to talk with you about a topic that is hard for most people to talk about, and that's suicide. You may be feeling suicidal, or a friend of yours may be suicidal. The important thing to remember is that the thoughts of suicide are very serious and need to be taken seriously. But today I want to talk with you about ways of looking at the thoughts of suicide and the feelings that go along with it. Suicide, I believe, or the thought of thinking about suicide, is the strongest message you can give yourself or to someone else about how much emotional pain you're in. It's the strongest message that you're sending to the world, that you're telling all of us about how much pain you're feeling, how you may be hopeless and helpless and really not know where to go, that you may feel that there are no other options. The important thing to remember is that there are other options, that you're not alone, and that there are many people out there who can help you. My discussion with you today is about looking at those feelings and also maybe a different way of thinking about it. If you have a friend who might be feeling really sad and hopeless and helpless, as I mentioned before, talk to them and see if you can get them opening up about what's going on inside. See if you can have them go deeper within themselves to look at why they're feeling this way, what's happening in their life. Is there something going on situationally that is really keeping them down and sort of stuck in this place? Again, suicide is a message that we give to ourselves and to others about how much emotional pain we're in. So anyone who is in that space is really in a very down space and a lot of times will isolate and withdraw. It's important that if you're feeling that way or if a friend of yours is feeling that way, to not isolate, to reach out, even though it might be really hard to do that, to talk with others or to get others who you feel are suicidal or you have a knowledge that they're very hopeless and they're in a bad space, just ask them. Ask them, are you feeling suicidal? Sometimes I have found that people will say, no, I'm not, but I've thought about it. Sometimes, certainly, people, when they're asked, will say no, that they're not, just to sort of push us off and to distract us away from that topic. But at any time, the discussion around suicide needs to be taken very seriously. Sometimes I have met with folks who will say, I'm not suicidal, but they'll tell me that they just want to get out of a feeling that they're in. They want to escape a feeling. And so I reference these as escape fantasies, not to diminish the thought of the suicide or the severity of the suicide, but to differentiate the discussion that we're having around it. So they're saying, I don't want to die, I just want to get out of a feeling. And we can work with that. We can really have a bigger discussion around that. You may be feeling that way yourself, where you don't want to die, but you think about dying, you think about the funeral, you think about your family that might be left behind, that sort of thing. And that is what I say is where some people might envisioning going to the beach, you're envisioning your funeral. It's just a different way of kind of getting out of or escaping momentarily the emotional pain you feel. And you're saying, well, this would get me out of that, but really it won't. And the thought over and over that you may be having around, well, if I were to die, this would happen and that would happen, that is really not productive, even though it may feel productive to you. It really isn't helpful and it's very damaging. If you're having those thoughts, you need to reach out to a professional, or if it's imminent danger, you need to call 911 or go to your nearest emergency room. Don't delay. Get help as soon as you can, because there is help that's out there, trained professionals who can walk you through this process where you don't have to do it alone. There are options. It is not a hopeless and helpless situation. There are always options. So remember that. The concept of suicide is a hard one for most people to understand, as far as if you say, or if someone you know is saying that they're suicidal. Most people would say, why do you want to do that? It doesn't make any sense. It doesn't make sense to the people who are not feeling hopeless and helpless. For someone who is hopeless and helpless, suicide makes a lot of sense, but it is not the answer. Suicide has been described as a very selfish act, and I understand now, having worked with survivors of suicide, families who have survived the suicide of a loved one, because it is the most devastating thing someone can do to their family or loved one or friends. When someone commits a suicide, they leave all of us with the wreckage of their choice and decision. I respect that that person is feeling hopeless and helpless, and I respect the depth of their pain and their sorrow. But the reality is, when someone commits a suicide, it leaves in their wake all of us left behind trying to understand and make sense of and to work through our feelings, having survived that person who committed a suicide. It is almost impossible to understand logically. In fact, it is impossible to understand logically. It doesn't make any logical sense to those left behind. But that's what so many of us do. We try to understand it logically, but there's no way we can. So it really creates a situation that the survivors of the person who has suicided, it creates a situation where we have to live with that for the rest of our lives. And it's very troubling. And some people never get over it. It's something that every person who is thinking about committing suicide really needs to take into consideration. Having worked with parents and siblings and grandparents of people who have committed suicide, I know firsthand how devastating it is, and that those individuals will never get over that. So reach out if you're feeling suicidal. Reach out to those people who you feel may be on the edge and who may be feeling hopeless and helpless. Consult with a professional. Call 911 if you feel yourself or someone else is in danger, and know that there are options. Thank you.